The fluorescent lights hummed overhead at 5:36 a.m., casting their flat white glare across the empty corridors of Oak Creek Memorial. Norfolk still slept outside the hospital's reinforced windows, the pre-dawn darkness absolute and unforgiving. Katie Morrison pushed through the staff entrance with her shoulders back and her chin level, moving through the hallways like someone who had learned long ago that hesitation announces you. Her scrubs were navy blue, pressed at sharp angles. Her badge hung at exactly the same height it had every day for the past 8 years. And in her locker, wrapped in a faded green duffel bag at the very bottom, beneath her spare shoes and a dog-eared paperback novel, sat a pair of combat boots that had seen things most people never survived. The boots were tan leather, scarred and weathered, with laces that had been retied 1,000 times in dust storms and monsoon rains. The left sole was creased deeper than the right, a permanent reminder of stepping over rubble in Kandahar. Katie never wore them. She never even looked at them unless someone asked, which people did, because worn boots in a hospital locker are the kind of detail that nags at curiosity. She opened her locker now, moving with the economical precision of someone who had packed field kits in helicopter darkness. Her colleague from the day shift, Nurse Jennifer Chen, was gathering her things from the adjacent locker. Jennifer glanced over, and Katie felt the familiar question forming before it even left her mouth. "Those yours?" Jennifer asked, nodding toward the boots. Katie pulled her stethoscope free from its hook and draped it around her neck. "My brother's. Air Force. He never came home." It was the same answer she had given 7 times before. Not quite a lie. Not quite the truth. People heard what they needed to hear, and they stopped asking because the story had an ending that made sense. A memorial. A closure. A reason for the boots to stay in the locker forever, untouched, sacred. Jennifer's expression softened with the kind of sympathy that came from not knowing anything. "I'm sorry." Katie nodded once and pulled on her light blue jacket. The jacket had pockets deep enough to carry everything: trauma shears, a penlight, a small notebook, her phone. She checked each pocket in sequence, a ritual that had started in a different life and never stopped. The boots stayed in the locker. The jacket went to work. The pediatric ward at Oak Creek Memorial stretched across the entire east wing of the 4th floor, 23 beds arranged in a half-circle around the nurses' station. At 6:15 a.m., only 2 were occupied. A 6-year-old with pneumonia slept fitfully in bed 4, his chest rising and falling in that labored rhythm that meant the antibiotics still had work to do. A teenager recovering from appendicitis lay motionless in bed 7, pain medication keeping him in a dark, dreamless place. The ward felt smaller in the early morning, the pale blue walls pressing closer, the sound of the ventilation system amplified by the silence. Katie logged into the computer at the nurse's station and pulled up the day's assignments. 23 beds. 2 patients. 3 nurses on shift. Her finger scrolled down the screen, checking vitals, medication schedules, notes from the overnight team. She did this every morning the same way, methodical, thorough, looking for the small details that other people missed. The 6-year-old's oxygen saturation had dipped to 88% at 3:22 a.m. The teenager's pain medication was due for renewal in 6 hours. Nothing critical. Nothing that demanded immediate action. But something worth noting. The break room door opened, and the day shift began to arrive. Nurses filtered in wearing the uniform exhaustion of people who had worked too many double shifts. They moved through the kitchen area, making coffee in a machine that gurgled like something being strangled, pulling yogurt cups from the shared refrigerator, checking their phones for messages from the world outside the hospital. Katie remained at the station, reviewing charts, waiting for the morning rounds to begin. At 7:13 a.m., Dr. Sterling arrived. He swept into the pediatric ward the way certain men moved through institutions they believed they owned, with the kind of confidence that came from degrees framed on walls and a last name that appeared on hospital donation plaques. Dr. Marcus Sterling was 48 years old, possessed a smile that never reached his eyes, and had the peculiar habit of speaking about patients in front of them as if they were furniture. He wore an expensive watch, Katie had looked it up once, a Rolex Submariner, $14,000, and his shoes had been polished that morning by someone who knew how to make leather shine like water. He was followed into the ward by a man in an Air Force dress uniform, Colonel Robert Callahan, his bearing upright and precise, every medal and insignia perfectly aligned. The colonel's wife stood beside him, one hand pressed against her sternum, her face carved from the particular exhaustion that came from watching your child suffer in a hospital bed. Behind them walked a younger nurse, Maria Vasquez, who had been assigned as their primary care coordinator. "Let's review our pediatric census," Dr. Sterling announced, his voice carrying the specific cadence of someone addressing an audience, though he was speaking only to the colonel and his wife. He stopped at bed for first, where the 6-year-old slept. Uncomplicated pneumonia, responding well to standard antibiotics. This is a straightforward case. He moved to bed 7 without waiting for acknowledgement. Post-operative appendicitis, pain controlled, discharge expected Thursday. He paused, turning as if suddenly remembering something important, and his eyes found Katie standing at the nurse's station. His expression shifted, rearranging itself into something that looked like concern but felt like evaluation. "Colonel Callahan, your daughter's case is significantly more complex. I want you to understand the level of expertise required for her care." He gestured toward Katie without looking at her. "Some nurses lack the sophistication for complex pediatric cases. Our protocol, however, ensures that I personally oversee every critical decision regarding Emma's treatment." The silence that followed lasted exactly 2 seconds. Katie did not blink. She did not shift her weight. She did not feel her face flush or her throat tighten. She felt, instead, a kind of absolute stillness settle over her body, the same stillness that came before difficult things, the kind of calm that was not the absence of emotion but the absolute mastery of it. She breathed in through her nose, held the breath for a count of 4, and released it through her mouth. One measured breath. That was all the visible reaction she allowed. Colonel Callahan's jaw moved slightly, tension rippling across the line of his shoulders. His wife's hand tightened against her chest. They did not respond, but Katie saw in their posture the kind of discomfort that came from witnessing someone being diminished in public and the knowledge that they were powerless to stop it. "I'll be reviewing Emma's complete medical history this morning," Dr. Sterling continued, turning his attention back to the colonel. "Please understand that we take her care very seriously. Very seriously indeed." He walked toward the medication room, leaving the Callahans standing in the center of the ward like people who had just survived a small, perfectly executed insult. Maria Vasquez approached Katie quietly, with a kind of apology in her eyes that meant she had heard every word. "He wants you on Emma," she said softly. The Callahan specifically requested continuity. "Emma's been asking about the night nurse. I think she'll be more comfortable with." "I'll take her," Katie said. Maria hesitated, then nodded and walked away. In that moment, Katie became the primary nurse for 10-year-old Emma Callahan, a child in a wheelchair whose spinal cord had been severed 18 months earlier in a car accident, and whose father was the kind of man who understood protocol and precision and the absolute necessity of following orders, even when those orders were being given by people who had no business giving them. Katie gathered the morning vitals clipboard and made her way to room 412, where Emma Callahan had spent the last 17 days. The girl was awake, sitting upright in bed with a tablet balanced against her legs, the blue light from the screen reflecting off her face. She was small for 10, her dark hair braided with meticulous care, her eyes carrying the particular intelligence that came from spending too much time in her own mind. "Good morning, Emma," Katie said, moving into the room with the quiet efficiency of someone who had performed this action 10,000 times. "I'm going to check your vitals this morning. You'll feel the blood pressure cuff tighten for about 30 seconds. Let me know if anything feels uncomfortable." Emma watched her with serious attention. "Are you the night nurse?" "I can be, if you need me to be. My dad said you're the best one here." Emma said this like a fact that could be verified, something she had asked about and received confirmation on. "He said I could tell by the way you move." Katie wrapped the blood pressure cuff around Emma's thin arm and began the readings. 120/81. Elevated, but not concerning. She made a note on the clipboard. Your father sounds like someone who notices details. He was a pilot. He said pilots have to notice details or people die. Emma paused. I used to want to be a pilot. But I can't anymore. The statement hung in the air between them, factual and final. Katie completed the temperature reading, 98.6 degrees, and recorded it without comment. Some truths did not require responses. Some truths just needed to be acknowledged in the room, allowed to exist, treated with the gravity they deserved. You can still be a lot of things, Katie said finally. Details are useful in a lot of jobs. Emma looked at her with sudden focus, as if she had just understood something important. Then she turned back to her tablet. Katie left the room at 7:41 a.m. and returned to the nurse's station, where the morning silence was about to break into the controlled chaos of the day's shift proper. She began preparing the medication schedule for Emma, cross-referencing every drug name, every dosage, every interaction against her mental catalogue of potential complications. This was where she moved into absolute precision. This was where she became, for all practical purposes, invisible in her competence. She caught medication errors that other nurses missed. She noticed drug interactions before they became problems. She had learned, in a previous life, that attention to detail could mean the difference between someone going home and someone going to a funeral. At 8:13 a.m., she made her way to the break room to retrieve her prepared lunch from the refrigerator. The break room held the combined smell of stale coffee and reheated food, a specific institutional aroma that Katie had learned to move through without reaction. 3 other nurses were gathered around the small table, Jennifer Chen, Laura Moss, and Denise Patterson. They were discussing a staffing change, something about a new hire starting Monday, and they stopped talking when Katie entered. She opened the refrigerator and withdrew her lunch container, leftover grilled chicken and vegetables, precisely portioned, and moved toward the table. There was space. There was always space. But as she approached, Jennifer stood up and stretched, and Laura began gathering her phone and coffee cup, and Denise checked her watch as if suddenly remembering something urgent. Within 45 seconds, the break room was empty except for Katie. She stood in the silence for exactly 3 seconds, then sat down at the table with her lunch. The fluorescent light hummed overhead. Outside the break room window, Norfolk continued its Thursday morning in complete indifference to the fact that Katie Morrison was eating lunch alone in a hospital break room, and that this had become her routine, and that the isolation had begun 8 days ago when she had walked into the medication room and found Dr. Sterling preparing to administer a dose of heparin to the 6-year-old in bed for a child with a severe sulfonamide allergy documented in 3 separate places in her chart, and had quietly, respectfully, said, that interaction is contraindicated. His history shows severe reaction to sulfonamides. We should use the alternative protocol. Dr. Sterling had looked at her the way someone looks at a fly that has landed on their sandwich. The protocol I'm implementing is the one I determine is appropriate, he had said. Not the one suggested by nursing staff who lack comprehensive medical training. Katie had not argued. She had simply remained in the medication room, her presence impossible to ignore, until Dr. Sterling had set down the syringe and switched medications with the kind of anger that comes from being prevented from making a mistake while being unable to admit that a mistake had almost been made. That was when the isolation had begun. Small at first. A glance not held. A greeting not returned. Then the systematic repositioning. Harder assignments. The unspoken agreement among the other nurses to distance themselves from someone who had challenged the hierarchy in a way that could not be forgiven because it revealed a failure that could not be acknowledged. Katie finished her lunch slowly, in the empty break room, watching the door in case anyone returned. No one did. When she was finished, she washed her container under warm water, dried it with a paper towel, and returned to the pediatric ward, where Emma Callahan was waiting, and where the combat boots remained in her locker at the bottom of the stack, patient and unseen. But that was not the worst part. The worst part was that Katie Morrison was running out of time, and she knew it. Every day the isolation deepened. Every day Dr. Sterling's authority over her work increased. Every day her presence in this hospital felt more temporary, more fragile, more like something that could be erased with a single phone call to the right person. She had built this life carefully, had created the identity of a competent but unremarkable nurse, had learned to move through institutions without drawing attention. But attention, she had learned in a previous life, was sometimes drawn whether you wanted it or not. The fluorescent lights above the unit board cast a sickly white glare across the paper Sterling had just taped there. Katie read it from across the break room, the words printed in that officious Arial font that made every institutional cruelty look official. Formal notice of protocol violation. RN Katie Morrison. Insubordination. Unauthorized clinical judgment. Failure to execute standing orders. Recommended review of licensure fitness. Her hands didn't shake. They never did anymore. She folded them flat against her thighs and took one measured breath through her nose. Around her, the morning shift nurses gathered near the coffee station pretended not to notice, but they did. They always did. Their voices dropped. A laugh cut short. Someone's shoes squeaked against the tile as they deliberately widened the circle away from where she stood. 8 days ago, she had watched Sterling reach for a medication order on a post-operative patient. Ampicillin and gentamicin, a combination that meant kidney failure for anyone with the patient's creatinine levels. She had said one quiet sentence, allergic interaction, doctor. Sterling's face had gone the color of old brick. He had scratched through the order and written a new one without looking at her, but the damage was done. She had contradicted him. In front of 2 residents and a nursing student. In a hospital where hierarchy was the only religion that mattered. The break room emptied. One by one, they took their coffee and left. Jenkins, who she had trained. Morrison, no relation, whose daughter Katie had babysat. Even Patricia, who had sat beside her in the staff lounge just 3 weeks earlier and complained about her divorce for 40 minutes without once asking Katie a question. Now Patricia didn't look back. Katie sat alone with her lukewarm coffee and her composed face while the hospital hummed around her. She had trained herself for worse silence than this. She had sat in silence while mortars landed close enough to taste the dust. She had held it while watching men in Kandahar bleed out because of a command from someone who had never seen a combat zone. This was nothing. Just a break room. Just a piece of paper. But it was also the beginning. She stood at 7:34 a.m., exactly 1 hour before rounds. The unit was still moving at that pre-dawn pace where the night shift hadn't quite left and the day shift hadn't quite started. Residents yawned in corners. Nurses were still finishing their charting. The hallway between the patient rooms and the nursing station was nearly empty. Sterling was writing notes at the main computer, his white coat draped over the back of the chair like a cape. He didn't look up when she approached. He was the type of man who could ignore you while simultaneously making your presence known to everyone around you. His body language broadcast, "She does not deserve my attention." Katie waited. Not in a submissive way. In the way someone waits when they have already made a decision and they're simply waiting for the moment to execute it. Dr. Sterling. Her voice didn't ask. It stated. He looked up slowly, as if it cost him something to redirect his attention. Morrison. I assume you've seen the notice. Your performance has been increasingly concerning. I read it. She took one step closer. The movement brought her into the sightline of the nurses at the far station. She felt them register it. This was not a private conversation anymore. I want to be clear about something. For the record. You're in no position to want anything. He turned back to the computer. A dismissal. The kind that was supposed to make her retreat to the corner and apologize and accept that she had overstepped. Katie had learned a different language in a different life. She spoke it now with the kind of calm that comes from someone who has already survived things that were supposed to kill her. I have seen what happens when people follow bad orders without question, Dr. Sterling. I have buried those people. The room went dead silent. The coffee maker stopped mid-cycle. A monitor somewhere beeping out its mechanical heartbeat became the loudest thing in the unit. Sterling's fingers stopped moving across the keyboard. Behind her, she heard a nurse's breath catch, the small sound of someone understanding that they had just witnessed something they would remember. He turned to face her. His face had the texture of someone who had just been slapped. "Are you threatening me?" "I'm explaining why I won't." Katie's eyes were steady on his. Not angry. Not trembling. Just absolutely present. "You can file whatever you want. But I will not let you kill a patient because you need the credit for saving one. Not here. Not for you." She walked away before he could respond, back down the hallway toward Emma's room. Behind her, she heard the whispers start. She heard her name and unhinged and military scattered like dropped coins. Let them wonder. Let them speculate. She had bought herself time with that moment. Time before Sterling figured out how to weaponize the questions she could see forming in his mind. Emma was awake, her small frame propped up with pillows, her legs in the custom braces that Katie had learned to adjust with the precision of someone who understood the architecture of recovery. The girl was reading a graphic novel about superheroes, the same one she'd been working through for 3 days. "Morning, Emma." Katie began her assessment without ceremony, checking vitals, inspecting the pressure wound on her hip that the braces were meant to protect. The skin around it was healing well. The 3-point suture pattern Katie had used was clean, precise, designed to minimize scarring while maximizing strength. Emma looked up. "My dad said you got in trouble." "Your dad shouldn't be discussing my employment status with you, but okay." "He was on the phone. He said that doctor is trying to get you fired because you're too good at your job and it makes him look bad." Katie's hands didn't pause in their work. But something in her chest shifted. 8-year-olds were not supposed to understand institutional power dynamics. Neither were 10-year-olds. But Emma had been locked in a wheelchair since she was 5. She had spent that time watching the adults around her navigate hierarchies of control and authority and who got listened to and who got ignored. "Your dad is a smart man." Katie secured the fresh dressing. "How are we feeling pain-wise?" "Like a 3. Maybe a 4. Emma's eyes tracked Katie as she moved. "You move different than other nurses. My mom noticed it. She said you move like someone who learned in a different place." Katie's hands went still for exactly 1 second. 1 second where the universe contracted into a single point and she understood that her cover was already beginning to unravel, not in some dramatic military revelation but in the small observations of a mother watching a child's physical therapist and a perceptive 10-year-old with too much time to study the people caring for her. "Different how?" Katie kept her voice level. "Like you know what you're doing. Like you've done it 1,000 times." Emma returned to her book, the observation made and catalogued. For her, it was just part of the data she collected about the world around her. Katie finished the dressing and stepped back. One day. She had maybe one day before that observation turned into a question that got asked at the wrong dinner table to the wrong person. The morning moved through its rhythms. Rounds at 8:15 where Sterling presented cases with the precision of someone who had something to prove. Katie stood at the back of the group, her face giving nothing away while he made his recommendations and the residents took notes like apostles recording scripture. The colonel was there, Emma's father, and his wife stood beside him with her arms wrapped around her own middle. They watched Katie. They noticed that Sterling did not look at her. They noticed the other nurses moved slightly away when she shifted position. They noticed everything and understood nothing. By 2:13 p.m., an army medic came through the unit. His daughter was being treated for an infection in the pediatric ward. He had explained this to Katie during morning vitals. A car accident 2 years ago. She had bounced back, but medical issues followed the way they always did for children who learned their bodies were fragile before they were old enough to understand resilience. He was checking on Emma for some reason. He and the colonel knew each other from a deployment 7 years ago to somewhere that wasn't discussed, and he watched Katie change the dressing on the pressure wound. He watched her hands move through the 3-point suture pattern with the economy of motion that came from doing something 10,000 times. He watched the way she secured each knot with exactly the right tension. Not too tight. Not too loose. Just perfect. When she finished, he followed her into the hallway. That suture pattern, he said quietly. His voice had the flatness of someone who had been through a screening and come out the other side. That's not standard pediatric closure. Katie kept walking. It minimizes scarring in mobile areas. It's SEAL medic training. First phase BUD CES, combat casualty course. He matched her pace. Only one unit taught that method, and they taught it in 2009 to 2015. Where did you really serve? Katie stopped at the supply closet. She didn't open the door. She just stood there, her hand on the handle, and let him see that his question had landed exactly where he meant it to land. That he had just named something she had spent 8 years trying to bury. I don't know what you mean, she said, but her voice had changed. Something in it had shifted from nurse to something else. Something with edges. Sure you do. He stepped back, understanding the weight of what he had just done. I won't say anything. But you should know, the way you move. The way you think through problems. My daughter's mom was a medic. I know what that looks like when someone's been trained to save lives in places where there's no backup. I just wanted you to know that I see it. And I'm grateful. He walked away before she could respond, back to wherever he had come from. Probably back to his daughter. Probably back to his own version of the life you build after the life you lived stops being official. Katie opened the supply closet and stood among the sterile packages and the bottles of antiseptic, breathing in the sharp chemical smell of disinfectant and gauze and all the things that hospitals used to pretend they could prevent chaos. Her combat boots sat in her locker downstairs. She hadn't looked at them in 3 weeks. She had learned not to. But she was thinking about them now. About the dust still embedded in the soles despite 8 years of scrubbing. About the way leather remembers where it's been even when the person wearing it tries to forget. The thing about identities was that they were built on patterns, and patterns could be recognized by the right eyes. Emma's mother. An army medic who knew the signature of a SEAL combat medic's training. And Sterling, who was probably even now making phone calls, activating his network, preparing to weaponize every inconsistency in her employment history. She had maybe 48 hours before it all came down. The night shift at Oak Creek Memorial moved like a living thing, monitors beeping their steady rhythm, ventilators breathing for patients who couldn't, the hiss of for pumps marking time in the darkness. Katie had worked 3 consecutive nights without complaint, moving through the pediatric wing with the kind of efficiency that went unnoticed precisely because it was invisible. She checked Emma every hour. Vital stable. Color good. The wheelchair-bound girl slept with the peaceful exhaustion of a child who'd learned to trust her nurse. At 2:38 a.m., Emma's monitor changed its song. The beeping accelerated from a steady rhythm into something frantic, urgent, a sound that made the base of Katie's skull tighten with recognition her mind wasn't allowed to acknowledge. She was at the bedside before the alarm finished its first cycle, her eyes moving across the ventilator readout, the oxygen saturation, the pressure waves on the screen. Tension pneumothorax. The clinical name was sterile and precise. The reality was catastrophic, air trapped in Emma's chest cavity, collapsing her lung, compressing her heart, crushing her with every breath the machine forced into her lungs. Katie's hand was already reaching for the call button when Dr. Sterling appeared in the doorway, still in his scrubs from afternoon clinic, summoned by the same alarm that had called to her. He moved into the room with the kind of authority that came from never being questioned, and what he saw, the girl's oxygen saturation dropping, her skin taking on the blue-gray pallor of inadequate perfusion, her small body rigid against the mattress, made him reach immediately for her chart. "She's spiraling into an acute anxiety episode," Sterling said. His voice was calm. Conversational. Certain. The child is clearly psychosomatic. Look at her, she's fighting the ventilator. Katie's jaw tightened. The oxygen saturation was 71. Dropping. The pressure readings on the monitor told a story Sterling wasn't reading. "Doctor, her unilateral breath sounds are absent on the right," Katie said. Measured. Professional. And her JVD is distending. I'm aware of the clinical presentation, nurse, Sterling replied without looking away from the monitor. The child requires sedation, not tension pneumothorax. Katie wasn't asking. We need a 14-gauge catheter. Second intercostal space. Midclavicular line. For the first time, Sterling looked at her. His expression was the expression of a man who'd never been interrupted during a diagnosis. Who'd never been corrected by someone without his credentials hanging on a wall. That procedure is invasive and premature, he said. The child is. Katie moved. Not with anger. Not with panic. With the muscle memory of a person who'd stood in a field hospital in Kandahar where there was no time for debate, where waiting meant body bags, where the people who survived were the ones who acted first and explained themselves later if anyone lived long enough to ask. She reached for the crash cart. Her hands found the emergency airway supplies, the needle tray, the antiseptic prep with a kind of precision that suggested she'd done this 1,000 times before in 1,000 different places. Step back, doctor, she said. Not a request. Not even particularly loud. Just the kind of command that made the air in the room reorganize itself around her. Sterling's face flushed. You don't have the authority to. But Katie wasn't listening anymore. She was focused entirely on Emma, on the girl's right chest wall, on the anatomical landmarks that were as real and true as breathing. She prepped the skin in one efficient circle, the antiseptic stinging clean, and her fingers found the second rib, the space beneath it, the precise point where air was building pressure against a child's fragile heart. Emma's oxygen saturation read 68. Katie didn't hesitate. The needle went in, 14-gauge angiocath, smooth insertion through the skin, through the intercostal muscles, through the parietal pleura. The moment the catheter tip breached the pneumothorax, the pressurized air escaped with an audible hiss, the sound of atmosphere equalizing, the sound of pressure releasing, the sound of a child getting a second chance at breathing. The ventilator's resistance dropped. The monitor's frantic beeping softened into something almost manageable. Oxygen saturation climbing, one of the night nurses said from her position near the monitor. 75, 78. 82, 85. Katie secured the catheter with tape, her movements economical, practiced, the movements of someone whose hands had held lives together in spaces where death was the default setting. She didn't look at Sterling. She didn't look at anyone. The room held its breath. Emma's oxygen sat at 88 now, climbing toward normal. The ventilator wheezed its mechanical rhythm, but it was a rhythm of recovery, not collapse. Blood pressure stabilizing, the night nurse continued. Heart rate coming down. We're good. We're solid. Sterling stood motionless by the doorway, his face the color of institutional failure. He watched Katie check Emma's lung sounds with her stethoscope, watched her adjust the catheter securing tape, watched her move with the kind of confidence that didn't come from job titles or board certifications. It came from having already survived the worst. Secure a chest X-ray, Katie said to the nurse without turning around. And notify respiratory we need that pneumothorax officially documented. Already called, the night nurse said quietly. Her eyes were very wide. Chest X-ray tech is on the way up. Katie finally stepped back from the bed. She pulled off her gloves with a snap like a gunshot in the silence. She still didn't look at Sterling, but she spoke to him anyway, her voice so low that only he could hear it. Pain was information, doctor. Clinical data. You weren't reading it. Sterling's mouth opened. Closed. He looked at Katie the way someone looks at a door that's just opened onto a room they didn't know existed. He turned and walked out of Emma's room without another word. The night nurse was staring at Katie with an expression somewhere between shock and recognition. That technique, she said slowly. The three-point suture placement. The needle angle. I've never. Where did you train? Katie was already washing her hands at the sink, the water running hot enough to turn her skin pink. She didn't answer. Some questions didn't have answers that fit into the shapes of civilian life. But what the night nurse didn't know was that Sterling had already pulled out his phone in the hallway. What neither of them knew was that by morning, there would be calls made to board members, to investigators with confidentiality agreements, to the Virginia Beach clinic where Katie's reference check had gone unanswered for 3 days. What they didn't know was that Sterling had already decided that a nurse who could contradict him once, humiliate him in public twice, and save a patient he'd misdiagnosed was a threat that needed removing. Emma's oxygen saturation stabilized at 92%. Katie stood beside the girl's bed in the dark, listening to the ventilator breathe, her hand still slightly wet from the sink. In the hallway, fluorescent lights hummed their fluorescent song. Somewhere in the building, Dr. Sterling was making the first phone call that would set everything in motion, not toward her salvation, but toward what he believed was her destruction. And that's when the real nightmare began. The morning after Emma crashed, Dr. Sterling walked into the hospital board's conference room at 7:36 a.m. with a file folder and the expression of a man who had just prevented a catastrophe. He didn't mention that Katie had been the one holding the decompression needle. He didn't mention that her hands had moved with the precision of someone who'd done this before in places where hesitation meant body bags. He sat across from 3 board members in pressed suits and told them that Katie Morrison had performed an unauthorized invasive procedure on a pediatric patient without physician oversight, without proper documentation, without consent. She took it upon herself, Sterling said, his voice carrying the wounded tone of someone betrayed by a subordinate. A 14-gauge angiocath needle. Direct chest wall penetration. That's not nursing. That's surgery. That's felony recklessness wrapped in a white coat she never earned. The board members exchanged glances. One of them, a woman named Patricia Chen with silver-streaked hair, asked a single question: did the patient survive? That's not the point, Sterling said smoothly. The point is protocol. The point is that some nurses believe they're above the system that keeps patients safe. Without boundaries, we have chaos. Without hierarchy, we have people deciding they know better than the physicians in charge. Katie wasn't in the room to hear this. She was with Emma, adjusting the child's oxygen delivery and checking the dressing on her chest where the needle had gone in and the tension had released and the girl's oxygen saturation had climbed from 68 to 94 in less than 90 seconds. Emma's mother stood in the doorway, watching Katie work with an expression that looked like gratitude mixed with confusion, gratitude that her daughter was alive, confusion about why the hospital seemed to be treating the person who saved her like a threat. Sterling's hands moved to his phone before lunch. For phone calls. Surgical precision in how he placed them, spacing them exactly 15 minutes apart so they seemed independent, uncoordinated, like separate threads pulling from different directions rather than a single orchestrated plan. The first call went to Gerald Whitmore, the board member who owed him favors from a malpractice case where Sterling's testimony had been professionally generous. Gerald, I need to speak with you about a personnel situation before the full board meets. A nurse who's been cutting corners, possibly exceeding her credentials. I'm concerned about liability. The second call went to the Virginia Nursing Oversight Committee's disciplinary officer, a woman named Diane Hutchins who had reviewed one of Sterling's cases 3 years prior and had taken his expert opinion as gospel. Ms. Hutchins, I'm required by my professional obligation to report a potential credential issue. A nurse at Oak Creek Memorial named Katie Morrison. I've been unable to locate her references, Virginia Beach clinic employment, the dates just don't add up. The gaps in her history are concerning. The third call went to the Virginia Beach clinic listed on Katie's employment record. A receptionist answered. Sterling identified himself as Katie's current employer conducting a background review for a promotion review. I just need to confirm her dates of employment and performance summary. The receptionist put him on hold. When she returned, her voice had taken on the careful quality of someone reading from a legal document. We can confirm employment from March 2015 to August 2019. Beyond that, we're not able to provide employment verification without a signed release from the employee. That pause. That legal caution. Sterling heard what he needed to hear, redacted. Buried. Hidden. Something worth hiding. The fourth call went to a man named Richard Cullen, a private investigator Sterling kept on retainer for what he called personnel issues. They were actually situations where other people's lives needed to be picked apart systematically. Richard, I have a name for you. Katie Morrison, age 38, current RN at Oak Creek Memorial. I need to understand her background. Employment gaps, financial history, any criminal or psychiatric records. And I need it fast. Cullen's voice sounded like asphalt grinding under tire treads. Define fast. 48 hours. That'll run you $3,000. Do it. The hospital suspended Katie that afternoon. The letter came at 2:06 p.m., hand-delivered by the HR director, a nervous woman named Rebecca who avoided eye contact the way people do when they know they're part of something that might not be righteous. The letter cited investigation into professional credentials, unauthorized procedure performance, and psychiatric fitness evaluation pending completion of formal review process. It was written in the passive voice of institutions protecting themselves, all subject-less sentences and bureaucratic distance. Katie read it standing in the break room with the coffee maker humming behind her. She folded it once, placed it in her scrub pocket, pulled her badge off and set it on the counter, walked to her locker without changing her expression, without letting the fluorescent lights above catch anything like moisture in her eyes. The locker smelled like the industrial soap that hospitals use, and underneath that, something older. She had kept a pair of worn combat boots at the bottom, the leather creased and salt-stained from desert sweat, the laces frayed at the ends. She had told colleagues they belonged to a brother who never came home. A lie that was close enough to the truth to feel honest. She pulled the boots out and held them in her hands, hands that had sewn a 3-point suture on a girl's pressure wound using a technique taught only in one unit, hands that had calculated needle placement and air release with the certainty of someone who had done it in the dark, in sand, with artillery fire walking closer. She put the boots in a plastic bag. Grabbed the rest of her things. The locker was empty by 2:38 p.m. She drove home in her Honda Civic, hands at 10 and 2, breathing steady as someone trained to compartmentalize fear. The rain started as she pulled into her driveway, not gentle rain but the kind that hammers the windshield like the sky was furious. She sat in the car for 6 minutes with the engine off and the rain drumming against the roof, listening to it, breathing into it, watching the water stream down the glass in rivulets that looked like someone was crying on the outside of the world. When she walked into the kitchen at 2:49 p.m., her son Marcus was sitting at the table with a glass of milk and a half-eaten sandwich in front of him, his backpack still on his shoulders, confusion spreading across his 9-year-old face like a stain. "Mom." His voice had that questioning lilt that meant he was trying to solve a problem he shouldn't have to solve. "Why are you home? It's not your day off." Katie stood in the doorway with the rain still dripping from her scrubs, and she couldn't stop the tears long enough to invent a lie he would believe. Her hands were shaking, not from fear but from holding it together so completely, for so long, that letting it crack was like shattering something that had been welded shut. The tears came in silence, the kind of silence that children recognize as adult terror, and Marcus stood up from the table without being asked and put his 9-year-old arms around his mother's waist because sometimes children understand that problem's older than they exist, and all they can do is hold on. She sat down at the kitchen table. Marcus climbed into her lap the way he hadn't done in 2 years. Outside, the rain hit the pavement in sheets, and Katie Morrison, senior chief petty officer who had survived Kandahar, who had sworn oaths she couldn't talk about, who had been ordered to disappear and never surface, sat in her kitchen and let her child hold her while everything she had built crumbled into water and uncertainty. She held the combat boots against her chest. For a moment, just a moment, she considered throwing them away. Letting them go. Becoming someone else entirely, someone clean and simple who worked at a tire shop or a pharmacy, someone without classified files and redacted records and a military past that wasn't supposed to exist. Someone Sterling couldn't destroy because there would be nothing left to destroy. But then Marcus fell asleep against her shoulder, and she felt his breath on her neck, and she looked at those worn boots with their salt stains and frayed laces, and she understood those boots represented something that couldn't be killed or erased or filed away. They represented who she was before the orders came down. Who she was still. And then she heard it. Distant at first, so quiet it might have been her imagination. Then clearer. The distinctive sound of helicopter rotors, multiple aircraft, the kind of rotor wash that comes with purpose and authority. The sound of them getting closer, not toward the highway, but toward the hospital. Toward Oak Creek Memorial in Norfolk, where she had just been fired. Toward the place where she had saved a child's life and in doing so, apparently, activated something that had been dormant for 8 years. The conference room at Oak Creek Memorial fell silent when the doors opened. 3 Navy officers in dress uniforms stepped through, dress whites immaculate, ribbons stacked above their pockets like medals from 100 different wars. The hospital attorney's pen stopped mid-sentence. The board members turned. Dr. Sterling's face went pale. The senior officer, a commander with silver dolphins pinned below his collar, surveyed the room with the kind of authority that made hospital credentials look like children's awards. His voice carried the weight of classified briefings and congressional testimony. Is Senior Chief Petty Officer Katie Morrison present? Katie's breath caught. 13-year-old Marcus was in the back corner of the room, permitted to attend because the board wanted him to hear that his mother was unfit. Untrustworthy. The lying nurse who'd falsified credentials. When those words, Senior Chief, hit the air, something changed in her son's posture. His shoulders straightened. Before Katie could move, before she could signal him not to, he stood. Senior Chief, he said. Not a question. A recognition. A salute without raising his hand. Katie's eyes closed for a single breath. The commander opened a classified folder marked with government seals that made the hospital attorney visibly flinch. The document was real, pages stamped with redaction marks, photographs printed on special paper that changed color under certain light. The commander began to read, each word dropping like ordnance into the conference room. 2 silver stars. He looked directly at Katie. The first for extraction of a downed F-16 pilot under direct fire, Kandahar Province, 2016. Call sign Angel 6. That pilot is alive because you moved through enemy fire with a trauma kit and left nothing behind but shell casings and blood that wasn't yours. He paused. Turned the page. The second silver star. Classification level compartmented beyond top secret. A classified operation that prevented a mass casualty event. 3 governments agreed never to discuss this. The details remain buried. The hospital attorney's face had gone the color of spoiled milk. One of the board members stood up. Sat back down. The commander shifted to the side, and a Navy SEAL commander stepped forward. His uniform carried a trident pin, the most difficult qualification in the military. His voice was quieter than the commander's, but it filled the room. Senior Chief Morrison was ordered into deep cover following that second operation. She witnessed actions that could not be officially acknowledged. For her security and the security of classified programs, her service record was expunged. Her identity was erased. She was given a legend, a false life, and told to disappear into it for 8 years. We do not bury our people. We protect them. And we know exactly who she is. Dr. Sterling stood. His chair scraped backward, a sound like fingernails on metal. His mouth opened. Closed. No sound came out. The hospital CEO rose slowly, her face hardened into something that looked like justice. She looked directly at Dr. Sterling and spoke 4 words that ended a career in progress. Privileges terminated. Effective immediately. Security had been standing by the door. The same guard who'd handed Katie a cardboard box 6 hours earlier, her belongings, her name on a termination notice, her professional license under investigation. He stepped forward now with another cardboard box. Sterling's nameplate came out first. A framed diploma. A photo of him at a medical convention. His security badge clipped to the edge. The guard set the box on the conference table and looked Sterling in the eye with a kind of quiet contempt usually reserved for people who hurt children. I believe you know the way out, sir. Sterling moved toward the door like something had gone wrong with his joints. His mouth kept trying to form words. His hand shook. Katie watched him pass within 2 feet of where she stood and recognized the look in his eyes, the same look she'd seen on prisoners in Kandahar who finally understood that no one was coming to rescue them. The senior Navy officer turned to Katie and extended his hand. "Welcome home, Senior Chief." She took it. His grip was firm. Familiar. The kind of handshake that meant something. You survived, you mattered, you were seen. 6 months later, the afternoon sun slanted through the hospital's tall windows, casting the parking lot in golden light that made everything look clean. Colonel Callahan walked through the front doors on forearm crutches, his daughter Emma beside him. She'd been walking for 93 days. The physical therapist had documented every single one, every small movement, every incremental miracle built from countless hours of rehabilitation and refusal to accept limitation. Emma spotted something and pointed. Through the windows, visible from the lobby, a folding table sat in the parking lot with a banner. The letters were still crisp, the folding table still metal-legged and cheap. But the man behind it had changed. His shoes were worn. His name tag read, Steve. A few brochures sat on the table. Supplemental Insurance Plans. He'd aged a decade in 6 months. When someone approached the table asking about coverage, Steve flinched. His hand shook when he reached for the papers. His voice came out wrong, too high, too uncertain. He kept glancing toward the hospital doors as if he expected someone to walk out and order him to do something harder than this. Katie didn't see him. She was in the pediatric wing, 3rd floor, where the morning light made the tile glow. Emma's chart was open on the workstation. The follow-up vitals were excellent, range of motion improving, sensation returning to her lower left side, pain scaled down to a 2 on bad days. Katie adjusted the girl's leg braces with hands that had once held a scalpel in a desert field hospital 12 years ago, hands that had pressed tourniquets into bleeding limbs while mortars fell, hands that had closed wounds that should have been fatal. Those hands now held the trust of every parent on the pediatric wing. That's what a senior chief petty officer did in scrubs instead of combat fatigues. She stood between the dying and the living, not with a rifle, but with skill earned through years of watching people survive the unsurvivable. Emma smiled when the braces clicked into place. "When can I run?" 3 weeks, Katie said. "You're already running." The girl didn't argue. She believed her nurse. That belief, simple, uncomplicated, unconditioned by doubt, was the only recognition Senior Chief Petty Officer Katie Morrison needed. Not a title on a door. Not a hospital badge. Not medals in a case. Just a child who trusted her enough to believe in tomorrow. The trembling wasn't fear. It was restraint. For 8 years she'd held everything back, every skill, every credential, every moment of brilliance buried under a false identity in a hospital that didn't know who she was. The weight of that restraint had nearly broken her. But now the weight had lifted, and what remained was something stronger, the choice to stay. Not because the military ordered her. Not because anyone had forced her back into service. But because this place, these patients, this work, this was where she decided to fight. Heroes walk among us. Sometimes in scrubs saving lives in the dark. If you're enjoying the story so far, hit that like button. And I'd love to know, drop a comment telling us where you're watching from.